So I cannot go on with all the charts. There's so many charts, but I at least explain to you to a certain extent what precision is. Okay. Again, this will give you a rough idea that you know to a certain extent, what works better and what works not so well. From here, you probably already understand to a certain extent because of the precision, A for A, you know now what is the best thing for your liver. So someone will say, oh, you take the supplement for the liver. Okay, if someone asks me again, I will say the best thing will be the liver for a liver. Okay, you can take any supplements for a liver. It can be milk thistle or it can be some other things, but those are supplements. Okay, but you really want the real repair on the liver, you really want the homing of the liver, then you have to give a liver. Okay, now the question next is, how many stem cells do I have over time? Oh, very little. It went off so fast. If you look at this chart, which was drafted by my side, when you're born, you have one stem cell out of 10,000 live cells. Okay, but by the time you move to 18, you realize it's 1 over 90,000. And when you move to 30, it's 1 over 180. Wow, that's alarming, man. It keep on doubling, And when you move to 60 years old, it's 1 over 800,000. So can you imagine 1 over 800,000 and 1 over 10,000? A lot of difference. But what happened when you go further down? You go further down, you age so much that when you die, you have 0 stem cells. 0. So that explains why there's no regeneration. Because there's no stem cells, how to regenerate? Okay. So imagine born with 37.2 trillion of live cells. As you go along, the amount of stem cells is so low. Okay, this is another chart draft by us. You can notice that the way you age is also very different. Okay, I remember when I was in my 20s, I can go without 4 days of sleep, and I work very hard, I study very hard. So some of the times I have to burn the candles, and the examination, all that, But now I come to realize not everyone can do that very well. Okay, although I'm sleeping 4 hours a day for the last 6 years, I do have my secret of how I maintain it. My secret is 1 of my hours is spent on the heart chamber. Every day I spend 1 hour inside the heart chamber. That equal to 3 hours of my sleep. And I take the liver peptides and the brain peptides to ensure I have very sharp brain, very sharp and alert, to ensure my liver don't burn. Because when you don't have enough sleep, you will burn your liver and you will have fatty liver. With stress, you will have fatty liver. Okay. So imagine this, the amount of stem cell going by, 100% by the age of 18. Wow, 40% is scary, man. By the age of 30, only 25% left. By the age of 5, you only have, age of 60, you only have 5% left. So that explains why the government of all the countries will say, oh, those 60 and above better inject the COVID first. Because once they have the COVID, they are positive, their chances of mortality will come in faster. Okay, the chances of risk of death is faster for them. So for that reason, you also have to make sure that you don't age at this time. You have to age longer with quality. So the organs have to age slower. Okay, so that's what I'm trying to say. The organs must age slower. You can age longer over time. Okay, so look at this chart. I always say acutely angled down. Not the same constant chart. You are not going constant. You're going like this all the time. Okay. So one simple thing to explain will be, if you look at your grandchild or your own children, okay, They can walk around the shopping center with you for 5 hours, or they can run around all over the place. You put them to sleep for half an hour, they wake up, they will run again. But you and I, probably after running for 5 hours or walking for 5 hours or doing our shopping the whole day, and you rest for 30 minutes nap and then you go again, most of us will not be able to do that. Most of us, okay? So that explains that the regenerations of the cells, the regenerations of everything is going slow. And bear in mind, regenerations can only take place when you sleep. When you don't sleep, you don't have regeneration, because the cells can only regenerate the organs during sleep. Okay, your brain have to regenerate during sleep. Your brain have to detox during sleep too. Some of the waste has to be removed from the brain when you sleep. So that affects a lot of things. Okay, so how long does it take to grow the cells now and the stem cells? Now you again notice they have different time frame. Okay, from days to years. So it depends, okay, from days to years. So that also explains why all the different organs will age differently. And that explains why the organs have different shelf life and the timeline for each organ. So this is a simple chart to show how the cells age. This chart is specially drafted for you. It is because we sincerely think this chart will explain clearly to you the many types of stem cells. Not all stem cells work. I will always say that. Okay, you have to use the right type of stem cells for the right condition, the right health condition of the patient, of our condition. Because there's so many types of stem cells, so to the layman, they say, oh, stem cells, yeah, it will work, you'll do everything. No. The answer is no. In my dictionary is no. In my years of experience of 36 years in this research, no. Same with all the scientists in our team. Okay, we deal with a lot of top scientists across the world. We are with the Soviet Unions in the old days, with the Russians. Today, we are with the people from Germany, Switzerland, Austria, and we are with the Americans. The answer is no. And even with some Chinese scientists today, and with our Japanese. Now, again, if you look at this chart, totipotent cells, right from the beginning on your right, you see that, the replication of the cells, it replicate and then it move down, you have the embryonic cells, and we call it pluripotent. Okay, the risk of having embryonic stem cells, the word embryonic means coming from the embryo, is that the cells can turn into all types of cells. That means you can turn into all the 400 different types of cells in your body of your 220 organs and tissue. So you have to understand that it may not turn the way you want it. Okay, it may go haywire, and overturn and become a cancerous cells. You have cancer cells in your body all along, but you will also have a bigger, more dangerous cells by the name of cancer stem cells. If you cannot solve the cells, how are you going to tackle the stem cells of the cancer? So for this reason, all of us, all the scientists of the world will try not to use embryonic stem cells because they have pluripotent capability of turning, and they can turn haywire. But if you go further down, okay, the embryonic stem cells may turn into two types of cells from here, okay, as they go around in organogenesis in the body or in the petri dish. Now they can turn into multipotent cells. They can turn into unipotent cells. So the word itself, multi, that means a certain amount. In this case, they will turn into the 8 different types of stem cells. 8. These are the 8 shown. Mesenchymal cells, skeletal muscle cell, epithelial cell, hematopoietic cells, and the rest. It goes on. These are the only cells, and these are tissue cells. Bear in mind, these are tissue cells. It is not the organ cells. On the other right, on your side, you have the unipotent. Unipotent cells are the precursor cells and the progenitor cells. The word precursor and progenitor means the same meaning. Okay. Now, when we call them precursor progenitor, these are cells with the word unipotent, only one. That means they turn into one specific cells. They don't turn into all kinds of cells. They will turn into all kinds of specific one type of cells. That means the lung will be the lung. The pancreas islet cells will be pancreas islet cells. The skin will be the skin. The pineal gland will be pineal gland. Pituitary will be pituitary. Okay? And it goes on. The spleen will be the spleen. The ovary will be the ovary. These are important. Okay? Because you have to look at the situation to give the right cells. Isn't it? You want to talk about precision, you have to give the right cells. So if the guy is having a lung problem, okay, is a post-COVID recovery, you know, he need to recover. After COVID, a lot of patients still suffer. Although they're discharged from the hospital, there are damages on the different parts of the organs. Okay, lungs are damaged, the brain could be damaged, okay, the kidney could be damaged. There's so many damages around, okay. So we have to observe which part of them and we give them the supplementation of the different organs. And we can also give them the therapeutic part of it where you have to, the doctors will have to inject the different types of cells, peptides, extracts, cells, or stem cells. So that's how it should be working. I make another chart out of this and explain in a clearer way from here the 9 different types of cells here. Because you'll be hearing so much, even the physicians are getting confused all the time. So I make a chart so that it's good for you to capture this chart and tell it to yourself and refer it all the time. Okay, we talk about the source, we talk about the characteristic, we talk about whether there's a surgical procedure to do that. Number 1, embryonic cells, the source is from the blastocyst. Okay, they are pluripotent. They will differentiate into all kinds of cells, including cancer cells. So you obviously cannot use embryonic stem cells. Number 2, autologous blood-derived stem cell, very commonly used all over the world. Okay, take it from where? Okay, you can take from your blood. You can also take it from the umbilical cord blood, or you can take it from the bone marrow, okay, of the patient. But normally they will take it from the blood or the fats, okay? Now, these are multipotent cells. Again, when I say multipotent, they are tissue cells. They are not organ cells. Okay, so what do you have here? You will have the mesenchymal cells most of the time. So the mesenchymal cells will turn into the muscle cells and the other 8 cells, like what I explained earlier on, the tissue cells. So tissue cells for the cartilage, for your knee joints, they'll be wonderful. They may turn. I use the word they may turn. They may turn means they may not turn too. So that explains why sometimes certain physicians will have very good result with the knee when they use MFC or mesenchymal stem cells on the knee. But sometimes they don't have a good result because the cells didn't turn well. Okay, so that explains the reason. Allogenic stem cells, that means the cells taken from another person. Okay, or we call them autografts. These will be from the blood or from the fats again. Again, these are exactly like number 2. It's just like it's coming from another person. Another person could be my son. It could be my daughter. It could be my father. It could be somebody else. Okay, again, they will turn into mesenchymal cells most of the time. Okay, and there may be some hematoitic cells too, okay, for blood disorder. So they are tissue cells. They are not organ cells. It depends on your disorder. Are you needing tissue cells or organ cells? Go further down, number 4, IPSC. The word is so attractive. A Nobel Prize winner won it. A Japanese scientist won it with a Nobel Prize by turning pluripotent cells into precursor or progenitor cells. He took the mesenchymal cells, which is the tissue cells, turn it back, going backward into pluripotent, and later on turn it into different organ cells. But this is still under research. For your information, there is no reality yet. Ask any cardiologist, any specialist of the world, whether have they been doing successfully with IPSC on a commercial scale. Sorry, the reality has not happened yet. Okay, it's only on research. So if someone were to tell you that, oh, the clinic is offering IPSC, I don't think so. This is my opinion, because I have not heard of any scientist of the world who has been offering IPSC at this moment, for the treatments of heart, kidney, liver, or any other organs. Okay. So in my opinion, the possibility where we meet with all the top scientists in Europe and US all the time in our annual gathering, it seems like it could be 15 to 25 years from today. It's still far away, in my opinion. Okay, move further down, number 5, hematoitic stem cells. Okay, now again, this can be taken from the bone marrow, the umbilical cord, or even from the blood. This is blood cells for blood disorder. They are multipotent. For blood disorder, that means thalassemia, leukemia, you may need them. Okay, so only for thalassemia and leukemia, and not for all kinds of disease, because you don't need blood cells for organs. Okay, the organs need organ cells, not blood cells. Okay, bone marrow stem cells, the word, because there's so many names, you're getting very confused. Okay, people come up with so many other names, even with stroma cells, all kinds of names all the time, so you're getting confused. Okay, now, bone marrow means from the bone marrow tissue. Okay, at the center of a large bones. What are they? They are mesenchymal cells, multipotent, again, tissue cells. Okay, but the funny part is, the risky part is you need surgery for this. So this needs surgery. So that is the risky part of it too. Okay, now number 7, umbilical cord blood stem cells. Wow, the Americans are such wonderful marketers. They came up with this umbilical cord blood stem cells into Asia and the Pacific. Okay, but umbilical cord blood is not commercially done in any parts of Europe. It's only with the public, that means with the government hospitals as research. Okay, in the case of umbilical cord blood, okay, what do you find there? Mesenchymal cells and hematopoietic cells, blood cells. Again, these are tissue cells. So mesenchymal cells will be good for tissue repair and stimulation of the organs, but don't expect homing, turning into the organ. You won't turn. Okay, so what about adipose derived stem cells? Again, the name, this means adipose means fat. It will take from your tummy most of the time because you have a lot of fats there. Okay, so the fats are taken up by the doctor and they can be reprogrammed and re-injected back to the patients. Okay, but what is inside here? Multipotent stem cells. Sometimes they call it stroma cells, but these are again tissue cells. Okay, so these are the situation we have here. Okay, and again, when we move further down, there was one type of cells which was quite unique but not very well known in Asia, well known in USA and Europe. Okay, we call them precursor stem cells, or a better word is progenitor stem cells. Okay, progenitors. Okay, now the good part about this is we spend so much time spending 30 over years with human stem cells. Okay, spending 30 over years with animal cells, spending 30 over years with plant stem cells. There are also stem cells of the plant, okay, from the buds and the shoot. The plant stem cells are the embryonic stem cells of the plant. Okay, so after spending so many years, we come to realize that you still need the animal cells, or we call them the precursor cells. Now, the animal cells here can also be the human, but the problem is you can't kill human. You cannot kill another human, take his organ and give it to another, to treat another human, right? You can't, and you need a lot of organs, a lot of cells from the organ. So even killing one human may not be enough. So because of this, we have to look into another way of getting the right cells, the specific cells, and the only suggestion is, the only way is to get it from animal, and that's what the Germans and the Swiss do in the old days, even with the Russians and the Austrians. That's what they do. The Europeans did this. organotherapy or stem or cell therapy has been done in the 19th century. And by 1931 or in the beginning of the 20th century, Alexis Karev, who won a Nobel Prize, keep a dead chicken heart alive. The chicken is dead, but the heart is alive, the cells, for 35 years. So these are one of the solutions we should talk about in science. The future of regenerative medicine could be lying in animal organs. The only problem with the animal organs is you have to choose the right animal. Okay, you have to have the right animal without any risk of zoonosis. That means they don't transfer the disease to human. Are you aware that human is also an animal? Human is the most intelligent animal. That's all. Okay, we are ancestor of the apes. We are animals. Okay, so the good part about this is in the fetal stage, please take care of this very closely. In the fetal stage, cells of all organs, including human, sitting on top of the animal kingdom, they are alike. The cells of all our organs, all the 220 organs of all animals and human, they are alike. The molecules are alike. The homology is alike. So that explains why there is no risk of antigenicity because it's in the fetal stage. It's not afterborn. Afterborn means the baby will suck the milk of the mother, antigenicity will set in because bacteria and virus will come into the body. When the fetus is inside the mother, the fetus don't have anything in its system. Okay, everything is transferred from through the placenta. That the detoxification, the transfer of nutrients are all through the placenta, through the umbilical cord. Okay, nothing go through the digestive system of the fetus, of the baby, of the fetus in the mother. Okay, only when it's out, it starts to go by itself. So this could be one of the answer, and in fact, to me, it is the answer. Okay, every day in our clinics across the world, we probably, in many of the clinics across the world, we probably are using human stem cells, but we probably are using in combination with animal stem cells, or we probably are using animal stem cells, or we are probably using the peptides. So there's solution for that. Okay, so these are unipotent. They will turn into one specific cells. A ticket of no return, a river of no return. The river never flow in another direction. It only flow in one direction. It has to go in one direction. I will call these cells undifferentiated cells in their final stage of differentiation. They are in the final stage of differentiation. They will only differentiate into a specific cells. It is important. And that's what you probably need to think of precision in regeneration here. This is precision, precise.